nau mai, whakatau mai ki tō tātou nei Puna Koorero mō tēnei ahi. Nau mai, whakatau mai. Hoi anō, I mua I tō tātou nei hui kōrero, māku hei whakatūwhera I tō tātou nei hui. Nō reira mi noi tātou. He honore, he karoria ki te atua, he mai ngā rongo ki runga I te whenua, he whakaro pai ki ngā tangata katoa. Nō reira I te atua, whakatata mai ki a mātou I tēnei wā. Arahia I wā mātou mahi, kia mārama, kia tika, mō te puinga o ngā tangata katoa, rire hau, pai mārire. Kia ora tātou. It's my great privilege to have our guest panelists on this afternoon. And kia rana kia koe Akarere, tēnā koe Janise. I thought we'll probably do a quick round of introductions first, and then we'll get right into our kōrero. So hoi anō e te marae kura, kei a koe te wā whai Akarere. E te mama.
Kia ora ana tātou katoa. Te roa maata tō tātou atu ko Yesu Mesia. Firstly, thank you, Rongo, for the warm welcome. And secondly, to also acknowledge Trust Waikato in this opportunity and this privilege to be able to be one of many champions for our amazing community in the South Waikato. I hail from the Cook Islands. On my mother's side, I'm from the northern part of the Cook Islands, which is Penryn. And on the eastern side, from the beautiful island of Eketone on my father's side. I currently am employed as one of the many amazing people that are part of an organisation called South Waikato, Pacific Island Community Services, based in Tukurua, but providing outreach and scope to the whole of the South Waikato, but in general to the Waikato as a whole. I'm grateful to have as a vision of an organisation that says we want to care for Pacific peoples today for tomorrow. And I hope to be able to give you some insights into what the tomorrow will look like for the Pacific people in this community and their aspirations for better outcomes of wellbeing. And yeah, really feeling very, very honoured to be a part of this panel today. Kia ora ana to Janise, and I know Janise in other forums, and I'm looking forward to her continued wealth of knowledge and expertise and general aroha for all peoples. So thank you again for this time that we can share together.
Oh, kia rana Akarere, and the privilege is all ours, I have to say. Kei a koe, Janise.
Ai, tēnā koutou. Janise Eketone. I hail from Waikato Tainui on my father's side. On our mother's side, I'm from Western Australia, part of the Ingara Wajiri mob, and so have some diverse cultures clashing in our whānau, which is really interesting. Yes, whai Akarere, I agree. It's a great honour and a privilege to be part of this forum and to have the opportunity to help communities be more informed about what's coming down the track with winter, and also to voice some of their aspirations through these types of forums, because only communities really know what communities need. And in my day job, I am employed by the District Health Board, working as part of the COVID response, and that's currently being expanded also into childhood immunizations, measles, mumps and rubella vaccinations, and also flu vaccinations. So kia ora koutou, lovely to be here.
So kia ora tātou. I just want to note that we have apologies from Dr. J. Tamatea. She is actually on leave and probably enjoying a well-deserved break throughout this whole period that we've been experiencing COVID-19, and she does put her apologies in, but she's enjoying a break with her whānau and her tamariki. So we won't be having her joining us today. So kia ora tātou. Hoi anō. I'm going to just start with you. And please, if you've got any questions, please put them into the chat forum, and we'll be able to answer them as we progress our kōrero. So I'm just going to go to you, Janise, and just get a snapshot on what are we going to be expecting over the coming months, in particular around what data has been modelled around where this Omicron, because there's a lot of kōrero going around our communities that there's going to be a second wave. So are you able to just indicate or share some information around what that looks like, and what we as a community need to prepare for?
Ka pai. Kia ora rongo. Well, you'd know that in recent times, the National COVID Response Protection Framework has changed. We've moved into a different level, into orange. And we also have the borders that have started to open up, and more whānau are coming home, which is lovely. But with our whānau coming home, there are other visitors that are coming with them, and more potentially. So not just just our whānau are coming. So we have the potential of other diseases to cross the borders, and that includes flu, measles, non-COVID diseases that over the last two years since the COVID response, or since we've been battling with COVID, our levels of immunisation haven't been maintained. They weren't good to start off with, but they actually, they've taken a bit of a dive over the recent years, and I'm sure Whai Akarere can talk about what's happening in the south of Waikato community. And yeah, so what's been projected, and the District Health Board is working with groups such as the Waikato University and the Public Health Unit in Auckland to predict what's coming, and it looks like there may be another hump in relation to Omicron, another variant of Omicron of COVID, and then the non-COVID diseases, and that would include flu, measles, RSV. So it's not a really clear picture, but with winter coming, those are the things that we think we need to be prepared for. Okay. And just an indicator, the hospitalisation projections that we're looking at, altogether and combined, the hump will be higher than what we've experienced in the Omicron outbreak. So what we've just come out of is going to, that hump of hospitalisations that we've experienced, it's going to be slightly higher than that, with all of those surges happening at the same time over the winter period, which is looking like starting end of May, beginning of June, and could go out to September, October.
Wow. That's very, very interesting, because we're hearing a lot out in the community that, now that Omicron has, peaked, we really, really don't need to safeguard our well-being. There's some conversations that have been happening. However, I'm going to hand it over to Akarere in terms of, as a result of the kōrero that Janise has shared, what are some of the things that you can share with us, Akarere, around what you've been doing in your community to prepare your community for the upcoming months?
I think good information, be more specific, the right source of information, because it would be fair to say that there continues to be some misguided opinions about budding scientists that have never gone to university but have an opinion, and unfortunately that continues to muddle the levels of information that we want to continue to provide for the community at large. What we've found is there's been a strong push in our preparation for Omicron in particular, in preparing families. So they had plans that they localised, that they adjusted to suit their situations. And as a result of that, they became much more self-determining about the elements of things that they needed to ensure were in place. However, what doesn't change, certainly from our perspective, regardless of whatever the government's framework is at any point of time, what continues to keep our people well is if we continue to maintain the public health safety measures, predominantly that keeping your distance, being able to wear a mask when you're inside, and if you're not well, don't go to work, don't go to school. Trying to provide and practice that level of self-care, self-awareness for their immediate bubble. So that stuff hasn't changed, and that's still something that I think has continues to hold us in good stead for whatever the variant, for whatever the other non-COVID related illnesses are going to come. We've always modelled as an organisation that it has been normal business as usual. COVID is this part, but everything else still continues, so that there is a sense of a wraparound, inclusive, comprehensive model of support still being provided. And we're fortunate that we've partnered with some significant partners, in particular our Waikato DHB and also our local iwi, Rakawa Charitable Trust. And it's been that collective approach that allows us to buffer all of the projections of how communities are going to be affected. We as partners, though, still have a responsibility on the ground to continue to provide the access. So in a rural setting, in particular here in the South Waikato, our ongoing opportunity is ways to improve access, whatever that may mean, whether it's to vaccinations for COVID, vaccinations for flu vaccines currently. We're moving towards a process of providing measles, mumps and rubella vaccinations, and alongside that, continue to provide the welfare, so that if we are going to engage in any space, that you take the opportunity to provide that whole level of support, rather than just providing someone with a box of rats, that you actually are able to look at the other elements and ensure that it is quite a whanau-centered approach. So some of those things have been excellent models for us to apply and implement, and I humbly would suggest that to date that has contributed to some wellbeing successes in our community. Are there still challenges? Of course there are, and life being as it is, it would be expected. So it allows us to continue to further develop on other areas that I may not have given greater awareness to. And in particular, we continue to see a rise in mental wellness, and so the ability to provide intentional approaches for those areas of our community, together with those that are disabled, again around access and providing greater vehicles of engagement. What I particularly like is that what works well too locally is local faces and local spaces with local voices continues to resonate as a powerful tool of engagement. So whatever it is, Janise, our attitude is, bring it, because we want to allow our people to be enabled rather than being dependent on services, and just growing their level of self-determination as to what that well-being looks like for them.
So you raised a good point, Akarere, regarding your whanau-centered approach. Can you just unpack that just a little bit for us? What does that look like, or in terms of your engaging?
I'm not sure if Janise wants to hear this, but anyway, so as you know that there are certain criteria or eligibility for flu vaccine, and so there's 65 plus and over, obviously 55 plus, which are Māori and Pacific. Our approach is that if that 55 plus lives in a home that has 5 other whānau members, then all of them are eligible for a flu vaccination. So we don't touch just the 55-year-old plus, we touch the whole whānau. and they're eligible, and anything that SWPX provides in any capacity is free. And we know that that worked for us during COVID, that we didn't have patient-centred or client-centred approaches, that you touch one member of a whānau, you apply the same kind of approach to every single member in that household. And we're going to continue with that model because it works. It may not necessarily follow ministry guidelines, but it's a South Waikato guideline that I think is appropriate for communities as it suits, as it fits. We're not the one size fits all, and we shouldn't be. That every other locality has the opportunity to tailor guidelines to best suit the response and needs of their community.
Absolutely. So there'll have to be mokopuna in that intergenerational household. So what does it look like when the mokopuna and the rangatahi and the whare too, when you're visiting the kaumātua? So how has your wellbeing approach in whānau approach been with the rest of the whānau?
I'm really humbled that we continue to have a visibility that it's almost second nature if our metua is being approached, that we then are able to go through each of the family and have that level of conversation with them as to what areas of support they are going to be requiring. And they are quite diverse, obviously, because it's intergenerational. So that if they are requiring, for instance, an MMR catch-up, then we're able to provide the access to ensure that that happens. The other area that we're giving a little bit more closer attention to is the childhood immunizations. So that when we're in those spaces, we can do that as well. Given that we can give COVID-19 vaccinations to 5 to 11-year-olds, it becomes quite a comprehensive approach to the whole family. So, and it may not even be health related, it may be other social determinants, but that's the whānau package of care. You know, we don't see health standing on its own as being the be-all, end-all for people's well-being. If we're able to touch all of these other areas of social determinants of health for them, housing, education, employment, we just know that this stuff works. And yeah, we continue to work towards those types of models. Are we always successful? Not necessarily, but in terms of where we were 2 years ago with this approach, we're far more along that line of continuum of wellbeing.
Fantastic. Is there any questions that anyone may want to ask via Akarere or Janise? Oh, all right then. I've got a kōrero kia rana. So this is from Robin Roa. Kia rana Akarere. Tai noa kia koe e te whanaunga Janise. We at our marae have just opened our marae after substantial rebuild. Oh, thank you, Trust Waikato, for your contribution. But since it has opened, there has been many groups and of course whānau tangi using our marae. What is your recommended approach to monitoring the large numbers now returning to the pā to attend tangi and or wānanga? Our marae has a policy, but we've found an inconsistency in our approach. What is your advice? Tēnā koe whai Robin, pai tō pātai. Janise.
Tēnā pai tō pātai, and it's a question that a lot of marae across the whole of the country are struggling with. The trustees are having and trying to have more informed conversations, and we've seen a broad spectrum of approaches with different marae. Really, I think the minimum expectation is to try and meet the standard as outlined in the COVID protection framework. So have your QR codes, encouraging whānau to scan in and out. And so if there is an exposure event at is an exposure an event at an event you have at your marae, people can be pinged on their phones to know that they were part of that exposure. There are other maraes that are also doing rats testing before going on to a marae. The dilemma with that is it's okay to be rats testing if you have access. So access is one matter, and you can order rats through the national framework. The other thing is that if people are doing rats testing and they are symptomatic, that they do we're not always seeing them load up their rats results. And it's important to do that so that if they are reporting positive or negative, particularly if they're positive, that then they can access the supports they need while they are isolating, and that and that their result is reported. We're not sure about the direction of travel about PCR testing. That's the swabbing at the testing stations, whether that's going to be coming back again. So we're waiting to hear about that from the Ministry of Health. But in terms of marae practice, those are some of the things that we've been seeing. We're continuing to see a lot of mask wearing. Masks aren't as critical, or not. They're not mandatory in the framework anymore, but we'd still encourage mask wearing, as Whai Akarere has said, hand sanitising. So having sanitize available, having masks available at the marae, encouraging mask use. The question of hareru, that's, I mean, kei a koutou, that's, you know, whoever's on the pie on the day, and it's a difficult thing to implement if you have different whānau coming through and using the marae without a consistent person leading the pie. But it's kei a koutou te mana, really. You are the bosses in your spaces. I hope that's been helpful. But yeah, masks here. I carry my masks with me all the time. Hand sanitizing, definitely having QR codes. They're easy to download off the website in every local hub. So you have COVID coordination hubs, and there's 12 of them across the region. They'll print the QR codes for you and get them out to you if that's what you're needing. So you can, and they can also distribute rats. So we can share those contact numbers also. I hope that's been useful. Yeah, but there is a wide variety of practice across marae, both in Waikato and across the whole of the country.
Excellent. And Whai Akarere, I'm just wanting to pose a question for you around the gatherings that the Pacifica people, and how you're protecting the whānau, and how you gather and where you gather, and how do you what type of information would you like to share with regards to
well certainly our version of our maraes, of course our churches, and the number of times we've had exposure events at our churches I can't count. However, the church has not done away with obviously wearing a mask and hand sanitisation, and if you're not well, you know, please don't come. But that has still left us at risk in terms of the number of exposure events. I think we continue to find a balance with meeting not only the spiritual needs of our community, but their cultural needs and their emotional needs, because we view marae in your context, in a tangata whenua context, as being the same as within our churches. And that part, not so much about keeping everyone safe. I'd be really interested to hear our maraes balance those kind of contexts for ensuring a more well-being approach for those that will frequent our bases, our homes, our maraes and churches.
Now, just in terms of what are some of the key messages that you'd like to share, in particular to people who are listening now, but also to, because the session is recorded, what would be some of the significant or priority areas that would be really, really helpful for a provider, say, a rural provider, in terms of if a family was to come to them, a Māori family or Pacifica family was to come to them, what would you recommend that a provider advises? And this may be a community centre, it may be a sports club, it may be a lot of things, but what would you recommend would be the best way forward for a Pacifica or Māori person from the community accessing other services and what they can be given advice on? So I'll go to you, Janise.
We're thinking that it's get connected, get protected. So if you're not already connected with a health provider, whether they have GP services or not, supporting whānau to become connected and maintaining that connection over the coming months, and then supporting them to get protected. Understand, do they have a GP? Are they enrolled with a GP? If not, let's help them to do that. The DHB will help with that process, and I can provide the 0800 numbers because there are some costs involved if you need to get birth certificates, which we can support with, and we've let all the provider network know that we will fund those. So get connected, get protected, and it's only local faces from local places that can really carry that message. So those who are listening, you are the local faces and the local places to carry that message. So that's probably the biggest one from me. And it relates to Whai Akarere's kōrero about access, helping people to access the services they need. Yeah.
Fantastic. Get connected, get protected, local faces at local places. Love it. Excellent. Thank you, Janise. Kei a koe, Whai Akarere.
Thank you, Janise. That's so succinct. That's why she's so articulate and can unpack, what I might go on and do a spiel about. I've not really got a lot more to add to that, except just to go back to that hub concept. And we're fortunate here in the South Waikato, we do have an 0800 here to help you, which is like a single point of entry into the community, and it gives you access to so many different range of services. So it's not just targeted towards health, it has housing, mental health, employment, kai, RATs, deliveries. So it's very, very comprehensive as to what the hub can provide. So certainly would be keen for people to continue to access those already established with a high profile hub mechanisms, and our Here to Help You portal here in Tokoroa, or the South Waikato as a whole. And just because I'm on, and if you'd like to grab a pen, 0800 568 273. So yeah, I memorised that number so that I'm immediately able to give that level of support. And although we have a priority around Pacific, one of the uniqueness of this community has been that we are one people. And so it doesn't matter which organisation that you would maybe approach, that we centralise ourselves through this one point of entry, and then it's disseminated out to the appropriate services that are able to provide that level of support. And thus far, it continues to hold us in good stead. I think one of the other successes for us is that we've really taken a strong leadership within all aspects of the community and COVID responses. So it allows us also to be that other port of call. And that's all I would continue to encourage, is that you utilise our community services on the ground. We're all connected, we enable each other, and there's no silos or pact protectiveness, which is probably one of the things that I'm especially proud about in our community, is our taokotaianga, our oneness that we have as a people who sincerely want to support and care for each other.
Tēnā rawa te koe, Whai Akarere, mō tō kōrero. Very relevant, kotahitanga, which is a collective approach, or a single approach, but with a collective of people, all with the same heart and mind to enable and support their communities to continue with their well-being. Another thing, Whai Akarere, you raised also in your conversation was around here to help you. So just for an example, if I was to be a whānau member in South Waikato and I access here to help you, and I have a number of issues, we've heard in the community that there's long wait times. But what would a whānau expect if we were to access your service, and what type of waiting time would I be expected to wait for to get connected with you?
I think it would be fair to say that in the initial surge stages, that there would have been quite a high volume, and I think it would be reasonable to expect no more than a 48-hour turnaround, of response of some kind, of connection of some kind. But there are always going to be those initial set-up processes around workforce, because as much as we as service providers want to provide, we also have had our own workforce challenges with staff that have that have had COVID or supporting COVID-related family members, and that all of that stuff was role modelled and forecasted. And as much as you put the best plans in place, human frailty is what it is. I don't want to say what my turnaround would be, because I that might be a little bit we as an organisation endeavour to respond as quickly as possible. But I don't think it's unreasonable for people to expect that it may be up to at least 48 hours, because once the contact is made, the actual turnaround, like I choose always to respond to a here to help you request within 8 hours, and that's my measurement or time frame that I will respond. So it really is about just getting that initial connection, and we're able to respond to organisations. However, I'm really confident that over the last 6 weeks, that turnaround has really reduced significantly. But it is a fair comment.
Akarere, I just
in the earlier times that there may have been a wait, but I would hope that that's been reduced quite quickly, such as being that vehicle for us to use, which is why we chose it. It works for us.
Akarere, that timing is absolutely amazing and really, really responsive to the needs of a person that is trying to access your services. During the peak time, 48 hours, I've heard in the community that there were 2 to 3, 4 days, even a week. So I want to congratulate you on that. And I also want to congratulate you on now that the numbers have reduced, on how quick you can respond to supporting someone of vulnerability in your community. So tēnā rawa atu koe, Akarere. Yeah, it was just a point I wanted to raise around, that if you get connected well, you'll get your protection at the same time. So yeah, I just wanted to raise that. Now,
I'm sorry, Donga, can I just add to that? I did agree with a kōrero that Janise brought up about what is reported in terms of data. We still believe that there is an unreported part of our community. And however, if they're not reporting it, then sometimes the support services may not be aware. So therefore that can limit supports that could be available if they had recorded their positive results, for instance. So it's once you record your results, whether they're actually negative or positive, it kind of like it unlocks, that whole mechanism of community supports that can be available for families. So that is the real big incentive for us, is that people should register, because that will automatically unlock this other greater potential. So don't I guess I'd encourage our communities, don't limit what can be available for you.
Okay, so in other terms is that please register what your results have been, either negative or positive, because it adds to the data, the valuable data that DHB need in order to see what the modelling is. Because I think a lot of people, like she said, have not been doing that, but yeah, thank you for that.
Yeah, not so much adding to the data, you know, I'm not hung up on that, Rongo. I'm more thinking that they get access to the support services. That's of more importance. And I know data is good, but we just want to know and be able to support appropriately.
Cool. Well, I just wanted to know if there's any other burning issues that you want to share with everyone this afternoon before we close the session off.
I had a couple of other points I just wanted to let everybody know about. Is that okay?
Yes.
There's another booster coming for our vulnerable communities. And so we haven't got all the details about that yet, but it may be in the middle of this year, so not far away. It'll put another layer of complexity on top of the vaccination campaigns that are already happening. So getting connected is even more important. So I just wanted to let you know about that. Get connected, get protected. I don't have any rights on that, so go use it, have it. Let's set something up ourselves. We can coordinate our own get connected, get protected with local faces from local places. Yes, here to help you. Let's share that 0800 number again, because Edina was on the last Puna Koorero, and here to help you is operating across the whole of the region. So the great efforts that are happening in South Waikato, they're also being replicated across all the communities and across the Waikato, wider Waikato region. I just want to mihi te whai Akarere and her team. They're the first team with the unregulated vaccinator workforce in the whole of the region. You know, that hats off. Like really, that's a really big deal. Like the District Health Board's only just getting unregulated vaccinators up and going, and your team is up operating and creating more capacity. Yeah, just mihi, ngā mihi, ngā mihi, ngā mihi. And encouraging all your employees to get their flu vaccination, ensure their boosters are done. A child with, we don't know what it looks like, but a child with RSV, flu, measles and COVID at the same time is not it's not going to end well. So let's think about that. And that's me. Kia ora.
Kia ora, Janise. And just ignore that hand there. It was supposed to be a heart, but I can't find it, so it's all good. And I don't know how to take it off, but that's all right. Whai Akarere.
I continue to be inspired as we surround ourselves with like-minded people. And you hit it on the head, Rongo. Those that have the same heart and the same mind. We may approach it in a different way, but when we're collected around those particular key values, nothing can get in our way is how I've been feeling of late in terms of a level of invincibility. I always like continuing to provide levels of protection. And so if there are other vaccinations coming that continue to provide that, then that's where we're going to be going. And we'll be very supportive of any other further layers of protection that we can provide for our community at large. And again, I just want to say thank you for this opportunity. We're going to be heading out to Tito today for a pop-up vaccination clinic. I've not been active in the Tito community, and I don't believe it's by coincidence that that we are actually going there. I believe that in God's time, he makes an opportunity available because it is the right time. And so today for me has a sense of rightness too, about this was the time to be able to have a kōrero, a talanoa, tuatua with each of you today. So thank you again, and continue to feel blessed to be around people that that model how we want our communities to flourish. Can I also just say about Jade, if that's not a role modelling of self-care, then I don't know what is. And we as leaders, as champions in our spaces, also need to be reminded to take care of ourselves as well. Kia ora ana, kia manuia.
Kia rana whaia, Akarere, that's so true. Everyone that's listening, you are precious in your communities, and please do look after your own well-being as well. O koe anō kōrua, ka nui taku mihi ki a kōrua. Kauta kōrua ngā mārei kura e hāpai ana ki te tiaki, te manaaki, i ngā iwi whānui katoa o tō tātou nei rohe ki a Waikato nei. Thank you. The amazing work that you continue to do in your communities, Akarere. I've known you for a very, very long time. And it's great also to see that you know how to look after yourself as well. But your work has always been significant in the South Waikato area in particular, but also the work that you're doing is well known throughout our region and also nationally. So ngā mihi nui ki a koe te marae kura Akarere. And ki a koe, Janise, you know, the work that you're doing has been outstanding and probably overwhelming at some during some stages as well. But I love that get connected and get protected. And I think that a lot of us need to start using that statement throughout our engagements with each other. So hoi anō, I'm just going to close with our session off with the karakia. Everyone's saying they've just loved the session with you too, and also giving some big mihis out to you in the chat area from Mareta and from Mareta Matenga and from Fire Robin Roa, and from another beautiful lady that I Tinara Watu Koe, I can't pronounce your name, but thank you so much, Kōrua. So I'm going to whakakapi I tō tātou nei kōrero mō tēnei ahiahi, no reira mi no tātou, kia tau kia tātou katoa, kia ta whai o tō tātou nei ari kia ihu kraiti me te aroha o te atua me te whiwhinga tahitanga ki te wairua tapu, ake, 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 ameni.